there is a need for cohesive COVID-19 procedures in nursing homes. A recent example is at Brighton Nursing Home in Beaver County. The facility did not have proper procedures in place, which resulted in 330 COVID-19 infections and 73 deaths. The facility is currently under criminal investigation and facing multiple lawsuits because of their failure to act promptly and properly in face of the COVID-19 pandemic. Nursing home residents account for almost 1/4 of all COVID deaths so far. A study indicated that nursing home size, urban location, and the percent of minority residents corresponded with the number of COVID cases. Maplewood Manor is in an urban setting and is located within a community with low SES. The Coronavirus Commission for Safety and Quality in Nursing Homes released a statement on the need for nursing homes to address issues regarding the HVAC systems, which their recommendations included adjusting for negative pressure and frequent replacement of filters as necessary, supplementing pre-existing HVAC measures such as air ionization and air scrubbers, and setting standards for the long-term plan and redesign of HVAC systems. They recommend single occupancy rooms wherever possible, but in the event that that's not possible, maintaining any sort of physical separation between roommates. Our intervention consists of multiple concurrent procedures in the Maplewood Manor nursing home that improve outcomes for both residents and staff while utilizing minimal resources. Our plan will separate residents by floor based on being COVID-19 positive, negative, or awaiting test results. Those with pending tests will be separated based on symptom status. Additionally, isolation of new patients these patients will be isolated before entry onto COVID-19 negative floors for an appropriate time. Staff break rooms, entrances, and elevators will be separated dependent on the type of floor the staff member is assigned to. So as far as the implementation of this plan, our plan separates residents into 4 cohorts: COVID-19 positive, COVID-19 negative, test pending, and symptomatic, which includes a fever, cough, anosmia, diarrhea, or possible overflow from COVID-19 positive spaces. And then the test pending symptomatic cohort, which is new admits in isolation who are being quarantined for 14 days but do not currently have any symptoms. Residents roomed in this cohort will be paired with other residents who arrived on the same day so that the clock on isolation does not restart every time you introduce a new resident into that environment. To look at a graphic of how we have this separated, so floors 2 and 3 will be reserved for COVID negative patients who have not had a significant exposure to COVID, have no symptoms, and there's no reason to believe that they are COVID positive. The 4th floor, because that is where the COVID positive cases began at Maplewood Manor, will be utilized for housing COVID positive residents. Additionally, because we need additional beds to house COVID positive residents, the 5th floor A wing will also be used for COVID positive patients. The B wing will be used to house the test pending residents who have symptoms of COVID, whereas 5C will be used for test pending new admits quarantine who have no symptoms. The staffing of these floors will be done in such a way that staff will either work exclusively on COVID negative floors or in COVID positive or presumptive positive floors, and their workspaces will be allocated in a way that allows them to maintain the distance. So, for example, on the 4th floor, the COVID positive floor, the patients will maintain themselves on this floor. The staff area will be used by the staff that has been assigned to that floor, and the fifth floor staff that is also treating patients and residents on the fifth floor will utilize this space if they are in contact with COVID positive or COVID symptomatic patients. The fifth floor staff that is serving the patients who are COVID test pending and asymptomatic will utilize staff break area and workspace on the fifth floor. The fifth floor has a chapel area and social area in the D wing, and that will also be used for those staff people. The social spaces, additional social spaces will be available on the first floor for COVID negative patients. For any patient that's COVID negative, they are able to use the dining halls and social spaces in ways that allow for social distancing. For example, residents will be assigned a shift in which they're allowed to use the dining hall to allow for fewer people to occupy that space at a time, but to allow residents to have some sort of outside stimulation besides their room. The courtyard on the first two floors will be used to facilitate visitation for COVID negative patients. And the elevators will be separated in a manner that the AB elevator will be used to get to floor 4, the COVID positive floor, 5A and 5B, and the C and D elevator will be only utilized to the COVID negative floors 2 and 3, as well as to serve the pending test asymptomatic population on 5C.